This takes heart.
And a strong team.
Across all units.
In every community we call home.
Here with support, training, and care.
Careers have no limits.
Here, with space to connect and disconnect.
Here, learning and growing with our communities.
And expanding what is possible.
Putting all we are
into everything we do.
Together, we are the heart of healthcare. Together, we are Fraser Health.
Morning huddle. You're going to see some cameras today because we're having a media shoot because we're famous today. So for morning huddle, just general housekeeping things that we do every day. Code white responder will be Priscilla from Zone 2, and then code blue responders will be Cassie and Deanna. So Cassie number 1, then Deanna as the backup. Okay, and with that, unless there's anything else, we'll close out for the morning.
What number would I be looking at here? So this is the pressure right here. Okay.
People want to work in a good environment. I love the job that I do, but I really love coming to work with the people that I do. And I feel very lucky to have the group that I have here.
I didn't even second guess going anywhere else. I just went straight to Fraser Health.
It's a very tight-knit group, so if I do have any clinical questions or I'm stuck with something, need to ask for help, there are always multiple people who can jump in and support me. But even outside of the work, they also are a big part of my day-to-day life.
I think one of the best parts for me working where I do with Fraser Health is we do like to have the diverse range of opinions and expertise to bring those different conversations together to really service the patient.
It's very collaborative here. The doctors are working with the nurses are working with the care aides. We're all in the same team. You know, you're all pushing towards the same thing.
I mean, it's very important that working in, especially in emergency, but in any healthcare role, that you have a team that you can rely on, that you can trust, that they've got your back.
She's got marked decreased airtry to this right side. So let's get that chest x-ray as soon as we can, then can we set up for a possible chest tube?
When I first started, I was a new graduated nurse, and it was my first nursing job, so I was very scared, especially jumping straight into the emergency department. But I felt, even on my first day, I felt supported. Everybody was asking me, welcome, what's your name, what's your nursing background? And as soon as I told them that I was brand new, I just felt all these arms just around me, just holding me and saying, everything's gonna be okay, we're all here, ask us questions if you need to. And that's one thing that definitely made me stay and kind of took the nerves away for sure.
So we're gonna select expert guide. We're gonna go there. Okay. We're gonna come in from over here and target right in the center.
Okay.
Yeah.
In Fraser Health, we're very supportive of anyone who wants to make advances in their careers.
During my 13 years at Fraser Health, I've been able to start as a volunteer in the emergency room. I moved then into a student nursing position, became a medicine registered nurse, and then have progressed from there to be an educator, and then a site services coordinator, and then I've moved into management.
Joining Fraser Health was a massive jump for me in my career.
It's education and support and mentorship that you get. That is a huge benefit to working in Fraser Health.
There's programs to help you get to where you want to go. There's mentors along the way that will provide you whatever support that you need.
If you're interested in a leadership journey, there's really robust training. You could do research, you could teach, you can do quality improvement projects with our community partners. You basically can make your career what you want.
Fraser Health is so large and you can be exposed to so many different avenues of opportunity here. Whether you're an electrician or whether you're a nurse or working in office, there's a spot and a position here for everyone.
Healthcare is more than just nurses and doctors. There's unlimited support staff that are crucial to having this place run properly. I take a lot of pride in knowing that what we do here helps save people. The infrastructure is just unlike anything I've ever seen. Getting in now when they're building so much, there's going to be tons more job opportunities. I feel like joining Fraser Health advanced my career about 10 years.
Fraser Health serves some of the fastest growing communities in Canada, and with that growth, it gives us opportunities to innovate to meet the demands of our health system.
It's rapidly expanding, the population is growing, and so with that there's been the development of a lot of new programs and technologies within Fraser Health, and so that leads to a lot of other opportunities.
As we transform our health services from one that is more sickness-based to wellness-based, we are relying on technology and digital transformation because it'll allow us to provide better care for our patients and families, enable our clinicians to release time for that care, and empower better decision-making.
Fraser Health's mission is better health, best in healthcare, and I think that's a very, very easy mission statement to visualize, you know, providing better health for not only our patients but our employees as well too.
For many of our Indigenous population, it's about providing culturally safe care. And our big challenge there is making sure we're educating our staff so that they can use appropriate bedside techniques to support patients in their cultural ways.
We've really got to significantly invest in that cultural safety that both our patients and our employees experience here at Fraser Health, you know. Being able to bring ceremony back into Fraser Health and your work life is so important, and we really want to set the precedent that Indigenous cultural teachings can train leaders and be applicable in a modern healthcare setting.
I'm very proud of our Fraser Health family, where we come together, whether it's a challenge or opportunity, to innovate and to provide best care possible for our patients, families, and communities.
The beautiful thing about Fraser Health is that there's so many different mountains and lakes. It's a really good work-life balance where you do feel like you can actually get away and take a full break and enjoy the outdoors.
Just the work-life balance. You get to work and play in such a beautiful environment. It's one of the only places where you could probably be, you know, skiing in the morning and be by the water in the evening, and just to have that on your day off is really nice.
I love it in Fraser Valley. You go from very urban area all the way to rural area. So there are many choices as to what you can do living in this area.
It's a great place to live and work. There's so much outdoor and indoor opportunities for recreation, and all within an hour or so's commute from pretty much anywhere in Fraser Health.
I absolutely love it here. There is not a day that we're bored or we don't know what to do or there's nowhere to go or nothing to see.
This opportunity has allowed me to stay living in the area I want to live.
Fraser Health is home. This is where I've been primarily for the last 7 years. It's been within this region, and I don't intend on ever leaving.
Fraser Health is one of the largest employers in the region. It's got the greatest equipment, it's where all the action is, and it's where I want to be.
There's so much opportunity here for us to be able to go out and explore, and I'm grateful for it.
There's always things I can learn, there's always things I can try.
There's something here for everybody.
It gives us a better living standard, better opportunities to be a better life.
I'm very proud to work for Fraser Health. There are very few employers that I have experience with where I have felt valued, where I feel like my voice matters, and most importantly, where I feel like I make a difference in my day-to-day work.
And I feel like I'm able to be a strong advocate for patients, stand up for things that need to get done in this role, and make a huge difference. And I'm excited to be able to do that every day that I work here.